Hi and hello, good morning, students. Today, let's see about ethics and ethical principles. At the end of the session, you will be able to describe ethics and ethical principle in a given worksheet as per rubric provided. What do you see in the slide? A doctor comes and informs the nurse about a patient that she has cancer, but her family doesn't want her told. When the nurse goes to the patient's side, the patient asks to the nurse, "Do I have cancer?" Here, the nurse has the issue whether to say the truth or not. If I tell her the truth, then I'm going against the family and the doctor. But I can't lie. What to be done? What you will do if you are in that scenario? Right, before we come to a conclusion, we must know about what is ethics and what all the principle is working behind this ethics. Ethics is a study of conduct and character. It refers to a method of inquiry that helps people to understand the morality of human behavior. It helps every individual to understand what is the morality of human behavior. If we come to know about, we will able to acknowledge others' feelings. We'll able to give respect for others' rights. We'll be able to protect others' rights and their behavior, so on. So that is what is called ethics. What are the principles? First one is autonomy, freedom from external control. Autonomy refers to the commitment to include patients in decision about all aspects of care as a way of acknowledging and protecting the patient's independence. Here comes the patient. For example, a patient comes and complains about abdominal pain. But the nurse finds there is no pathological reason behind the pain and there is no objective sign for the pain, even though the nurse should not disregard the client's subjective accounts of their symptoms. Though she doesn't have any pathological reason behind it, she has to acknowledge the patient's feeling. All the subjective symptoms may not accompany with the objective sign. All the subjective symptoms may not accompany with some pathological finding. The nurse has to give respect for the feeling of the patient and she should protect the patient's independence. She should allow the patient to take a decision on his health. I have pain. It may be the truth. We have to regard their feeling and we have to accept and we have to act accordingly. That is what is called autonomy. Second, beneficence, doing good. Beneficence refers to taking positive actions to help others. The principle of beneficence is fundamental to the practice of nursing and medicine. It means doing good. Nurses are always obliged to do good, that is, to implement in action that benefits the clients and their supportive person. For example, the nurse gives advice to the client about exercise program to improve general health. It's doing good. So by giving advice, she's doing good to the patient to improve the general health. Next one is non-maleficence, do no harm. Maleficence means harm or hurt. Non-maleficence is avoidance of harm or hurt. Harm can mean intentional or unintentional. In nursing, intentional harm is never accepted. So what is this do no harm? I'll give you an example. While catching a client who is falling, the nurse grips the client tightly enough to cause bruises to the client's arm. Caregivers do not always agree on the degree of risk that is morally permissible in order to attempt the beneficial result, what happened now in the patient. So this is do no harm. Hope you can understand. Next principle is justice, means fairness. Justice refers to fairness. The term is most often used in discussion about access of healthcare resources, including the distribution of resources, etc. I'll give you another example. A nurse making a home visit and finds one client very tearful and depressed, and she comes to know that she could help the patient by staying 30 more minutes to talk. If she talks, the patient's emotional status can be stabilized. But however, that would take time from the next client who is a diabetic who need a great deal of teaching and observation. Here, the nurse will need to weigh the fact carefully in order to divide her time justify, justify among the clients. So, to whom to give importance first? To a diabetic client who need a great deal of teaching, or a depressed client who need a 30 more minutes accompanying. What I should do? Here comes the fairness. Next, about fidelity, keeping promise. Fidelity refers to the agreement to keep promises. It means faithful to the agreement what we make with the patient. Nurses often make the promises such as I'll be right back with your pain medication, or I will find out for you. The clients take such promises very seriously. So nurses has to take their utmost effort, I'll say 100% effort, to fulfill the promises what you made with patients. That is very essential in everyday practices of nursing with the patient. The last one is veracity, that is telling truth. It is being honest and telling the truth and is related to the principles of autonomy. Although sometimes it seems to be very straightforward, but in nursing practice of choice, this is not always clear. Hope you remember about the first slide. What the response the nurse has to give for the question asked by the patient. Do I have cancer? Here the nurse knew the answer, but whether she can tell truth or not. If she says the truth, she may be against the wishes of the family members and the doctor. But according to the principle of veracity, she should tell truth. She should not lie. So what decision the nurse will take there? It all depends upon the degree of harm it's going to cause or the level of patient's emotional status. The nurse has to take a decision. Here comes the fairness to whom she has to give importance for the family members' feelings, or that may precede the principle of veracity. Depends upon the situation. The nurse has to take a decision. It's really a higher order cognitive ability and knowledge and experience is needed for every nurse to deal with such kind of situation. So, dear students, today we have seen about 6 main principles. Those are very basic but extensively essential for everyday nursing practice with the patients. Just a list down. The first one we have seen about autonomy, non-maleficence, beneficence, justice, fidelity, veracity. Hope I am clear with this content. If you have any queries, you can chat with me and you can call me and clarify your doubts. Hope I am clear. Thank you. Bye-bye.